Hi, guys. My name is Michaela Childs, and I'm here today with Sydney McMeans for her podcast concerning the flaws in our current radiation based cancer treatments. Hi, Sydney. How are
Hi,
you?
Michaela. How are you? Thank you for having me
Of
on.
course.
So, Michaela, did you even know that some cancer treatments can cause cancer?
What?
Yeah, I know. That was my same reaction. So, I guess to kind of start us off and give them a baseline explanation for how radiation causes cancer, there's this process called genomic instability. So, Sigurdsson and Jones, in their research, explored the implications of genomic instability, particularly in the context of radiation induced carcinogens or things that cause cancer, suggesting that genomic instability is the key driver of cancer development after radiation exposure. And the way that it works is that when the cell is exposed to radiation during the mitotic process and when DNA is splitting and when there's cell proliferation, mutations occur, and that usually allows for cancer to come in and then for the cancerous proliferation to go on.
Oh, wow.
Yeah.
Okay. I did not know that.
Yes.
So, I just wanted to ask you like a little bit about your process. Like, how did you start? What prompted your interest in these radiation based treatments?
Yes. So I've always been interested in medicine since I was like 11 and broke my foot. And I was like, this is something that I really want to do. And when we got into just DSP and when we got to the research process, I definitely knew that I wanted to do a medical topic. And I knew that cancer was a very empirical based topic and that a lot of it was in the works and research. So I thought that I'd start here. And then that was kind of the genesis of all of my research.
Okay. Okay. So, like, when you actually started your research, I know you started in sophomore year. So, how did your lit review set you up for now? Or what did you do in your literature review that got you to where you are now?
Yes. So when I knew that I wanted to study medicine for in DSP, I was like, okay, let's look at cancer. And I was like, what is one question that no one has really answered about cancer? And that is how to exactly cure it. So I basically set out on a journey to find the most efficacious way of curing cancer. And throughout my research, I realized that there was a certain cancer treatment that was causing more cancer. And
Ooh.
naturally I was like, okay, what the heck? Like that's the antithesis of what should be happening. We should not be, causing more cancer when trying to cure cancer. And that's just also terrible for the patient, especially since cancer is a field wrought with so much grief and that just compounds the grief. So that's what I did my sophomore year. And I focused on the radiation aspect of it my junior year. And my literature review basically analyzes a ton of um, ionizing radiation and non-ionizing radiation in our world, so I can compare it to the research that I am doing now to show how dangerous it is in our world and just how dangerous it is in the medical field as like a point of comparison. Here in my current research for my dissertation, I basically looked at the radiation-based cancer treatments that we are using now, and I realized that we needed to reform them. And when I was thinking about it, radiation isn't necessarily something that we can just get away from in the field of oncology because it is known to be efficacious. It does shrink cancer cells. And obviously, we're not going to completely throw away a treatment that or a basis for a treatment that is efficacious. So I was like, if you can't beat them, join them. So I just kind of set out to do some reform. So I analyzed four different therapies that were kind of broad subjects in the radiotherapy field, and I just kind of picked them apart where I could and compared them to each other to see which is best for patients and which ones need to be improved.
Okay, so I know for your independent research, you kind of focused on these different radiation treatments, and you kind of did this through shadowing doctors and specialists. So, like, how did you go about that? How did that method and that process work?
Yes. So I know a breast doctor from my church. She's wonderful, works up in Memorial Hermann, and she let me follow her around all day. And she deals with a lot of cancer patients. And though she isn't necessarily an oncologist, she pretty much is in the field of oncology as she's kind of migrated away from general surgery. So she took me around her clinic and I got to see patients. She'd do the breast exam, she'd talk to them about their prognosis. And she'd refer them to various oncologists and stuff, like treatment oncologists, which is the more specialized version of oncology. Um, and, she has a very general baseline level of oncology, which is exactly what I needed to jump into this research because, I'm a child going into the field of oncology. I don't know much, and I really had to rely on someone with that information to set me off. So she taught me kind of what the treatment oncologists would look for when trying to describe regimens of, say, radiotherapy or chemotherapy, or she also does tumor excision surgeries as a breast surgeon, and so she taught me kind of like when we need to do that, which augmented my understanding for my research for my sophomore year, so I could take that into the comparison for the research for what I'm doing now. And I just kind of got to go around the clinic and bond with patients and see how it is on their side, so I could be more sensitive when I was doing the research side, because often the research side treats people as a number, and I really thought that that was important to extract from my research. Yes, and then, one of my other good friends is a pediatric oncologist who works up at Texas Children's, and we just talked about all of the therapies that were currently being used, the radiation-based therapies that are currently being used in the field of oncology. And I used those therapies that we talked about for my regression analysis, so I could determine their efficacies in comparison to what the medical field was saying and, kind of pick them apart and find their flaws. And she took me around the treatment facility on the floor below us, and I got to meet some patients and see kind of how everything worked. So all of that makes up the narrative inquiry part of my dissertation, and it's necessary and helping me understand, why I'm doing this, how I should go about this, and it's the baseline basically for all of the research that I'm doing.
So I understand that you went around with these specialists and you watched them through their day-to-day lives and they explained their treatments. So even though you might not have completed it yet, what has your regression analysis told you so far? What have you learned about the flaws of these treatments so far?
Yeah. Well, first, I'm going to explain the treatments. So I looked at first proton versus photon radiation. So proton radiation involves the emission of protons, which are charged particles. It's used in proton therapy to target and destroy cancer cells with minimal damage to healthy tissue. So kind of a more targeted approach. And then photon radiation, which is kind of like X-rays, is generally more likely to cause secondary cancers than proton radiation because of the less generalized approach that it has. It involves high energy light particles or photons that penetrate the body to target tumors, but doesn't necessarily have a boundary through the healthy tissue. So those were two that I decided to kind of more heavily compare. Well, I obviously had four therapies, and two of them I kind of compared more against each other as I went through the
Okay.
research process, and the other two I were a little bit more general or were a little bit more specific, and I compared those two against each other
Okay.
because what I kind of focused on because of the pediatric oncologist was leukemia, and these are more leukemia treatments. They are obviously used in other types of cancer, but for the sake of comparison, I just compared them against each other.
Okay.
Yeah, so basically proton versus photon radiation, I found that photon was obviously more dangerous for causing secondary cancers because it doesn't have the targeted barrier. It has kind of like how chemotherapy works, it has a blind eye to all cells versus, proton is like directly in the tumor and you can pinpoint it more easily. Not saying that proton can't cause secondary cancer because of the ionizing radiation's toxicity, but photon is more dangerous. And on the other hand, I looked at brachytherapy, and that involves placing radioactive sources directly inside or very close to the tumor. Because the radiation is localized, it minimizes exposure to surrounding healthy tissue, leading to a lower risk of secondary cancer compared to the external radiation therapies. And then MIBG therapy uses a radioactive isotope, usually iodine 131, to target the cancer cells, particularly in neuroendocrine tumors. So MIGB therapy has a bit of a higher risk of causing secondary cancers compared to brachytherapy because of the iodine and because it's more widespread throughout the body. And especially since it's usually used in neurologically based cancers, that is obviously harder to treat and it's also harder to specialize. I mean to pinpoint the tumor. So MIBG does have a higher likelihood of causing secondary cancers.
As
So
compared to the Reiki.
the brachytherapy,
Okay.
yes. Yes. So I, through my research, found that it was best to, instead of look at all those four, compare the two against each other.
Okay.
And that's kind of what I formulated.
So
Yeah.
you broke them into like these two and these two.
Yes. And I found all of this information. Obviously, I got the therapies from my discussion with the pediatric oncologist, but I found all of that information from compiling many sources from various databases into my own regression analysis.
Okay. So knowing what you know now and based on the types of treatments you've learned about, what do you think people should know about this? What do you think the general public should take away from this?
Yes. So I definitely think the general public should be more cognizant in cancer treatment because even though it may not be happening to them, it may be happening to a friend. And obviously, everyone should be as cognizant as possible about the risks of cancer treatment because since we don't necessarily have a perfect cure for cancer, we have to know the risks of it because if if all fails, we have to know what we're getting ourselves into. And that's kind of just the reality in cancer treatment because we don't have perfect therapies. And we're probably not going to have perfect therapies until we have another breakthrough. So on, I guess, the patient side, they should be cognizant of all of this. And then on the physician side, I think there should be a lot more clarity in the explanation of this because there have been a lot of patients that I've talked to that have gotten radiotherapy treatments, and they have not known that there was a chance that they could have developed a secondary cancer. And obviously, that's pretty alarming to them. And I get that the treatment oncologist has to pick the treatment, but the patient obviously should have some kind of say because it is going into their body. And, if they're having to go through the cancer treatment process again, I mean, that could be detrimental to their health
So you think
even further.
So you think physicians should be more straightforward with the explaining the risks of the treatment?
Yes, but I mean in a more general way. I think it should be more well known in the field of oncology and even outside the field of oncology. Because a lot of people were very surprised when I'd mention this to them. Like whenever I'd be at church and I'd be talking to a friend, be like, "Hey, what are you doing in school?" I mentioned this to them, they'd be like, "Oh, I've never heard of that before. I didn't know that was a possibility." And I think that we shouldn't have that shock when this is brought up.
Yeah, I didn't know that was a possibility either until you told me about it.
Yeah, and
So
I was talking to a drug rep on Saturday at a church event, and he used to work in he used to work in the field of oncology, and even he wasn't really cognizant that this was a thing.
dang. So I guess you've kind of explained how physicians should go about talking to patients about this and how they should make it more well known. How do you think the medical field can improve on these types of treatments in the future? What do you think they can do?
The difficult thing about radiation-based cancer treatment and just cancer treatment in general is there are so many things in clinical trials, especially the improvements. I think that clinical trials should really be prioritized right now in the methods that we're using to protect patients from radiotherapy, which is initially one I wanted to do my research on, but there just wasn't enough out there in the medical field that I could have done with it, especially as my age as a child.
Yeah.
But I think that there should be an emphasis on it, especially in the field of oncology. I think radiation needs to go through a lot of reform. And again, just there needs to be a lot more transparency with this. And obviously, when focusing on it more in the field of oncology, that should hopefully come naturally.
So in the future, knowing what you know now, what would you do? What would your future research look like if you were to continue this topic?
Yeah. So, I mean, obviously, I would want to kind of go back to the general idea behind my sophomore year research and try to find the most efficacious cure for cancer because I know that there is a lot more that I'll be able to get my hands on when I attend Trinity University next year because they're very pre-med based and there's a lot of cancer research going on there. And I'd be able to take my research even further there. And also, um, I would want there to be a lot more. I would want to look basically into the pairings between different treatments because there's a lot of cancer cases where you do chemotherapy and then the neoadjuvant. I mean, tumor excision surgery and the neoadjuvant chemotherapy. And I'd kind of want to look into the pairings and the efficacies of that because there have been more cases where pairing those two treatments have been more efficacious than radiation. So in an attempt to reform radiation, I think we should migrate away from it just a little bit in the cases that we can so we could allow some breathing room for that to be fixed. Because, I mean, patients every day are still getting it and patients every day are still being exposed to the risk of developing secondary cancer. And I'd want to look into basically how to do that. And, obviously augment the field through my research.
Okay.
Yeah.
Well, someone is going to be a very lucky patient one day if you're their doctor. So
I've got to get through medical school first.
hopefully that's me, guys.
Oh my gosh. Hopefully you don't get cancer, girl.
No, hopefully not.
Oh, okay.
Not
That's what I thought you
manifesting that.
said.
Not
Yeah, let's not
manifesting
manifest that.
But I would hope you would be my doctor, of course. Okay. Thank you so much for doing this with me today.
Of course. Thank you for having me on.